What if I told you that a smartphone app can now diagnose skin cancer as accurately as a dermatologist, or that a surgeon in New York can actually operate on a patient in Mumbai using robot? This isn't science fiction. This is ICT in medicine, which is happening right now. In the next few minutes, I'm going to show you how technology turned hospitals into smart facilities. How AI is predicting heart attack before it happens. And how a simple wearable device is saving diabetic patients' life every single day. Welcome to the future of healthcare. Let us explore it.
I'm Secretary and I'm going to introduce the presenter of each group. First group, consisting of Sri, Puri, Idrina, Tira and Ivy, will focus on diagnostic and treatment. Second group, made up of Halima, Haifa, Vera and Nutman, will be going to do data management. Third group, Shahira, Ajab, Putri, Nana and Danish, will be working on connectivity and patient care. Group 4, including Roshan, Tanuj, Adam and Yusian, will focus on medical research. Group 5, Hana, Tengku Putri, Tiro and me will do administrative function.
Diagnostic means identifying diseases through test or scan, while treatment refers to managing or curing the disease. Technology has greatly transformed healthcare, making it more accurate and efficient. Key innovation include MRI and CT scan for detailed imaging, AI for data analysis, and robotic surgery for precise operation. The goal of this advancement is to improve accuracy, safety, and speed in medical care. In this presentation, we will explore how this technology works, their benefit, and their impact on modern healthcare.
Magnetic resonance imaging. MRI is a medical technique that uses strong magnetic fields and radio wave to produce high-detail images of the body without using any radiation. So, this makes it more safer than CT scan and X-ray. It's especially useful for viewing soft tissues like organs and brain. In addition, MRI also can help doctors to detect early disease such as tumor. One key advantage of the MRI is it can produce high-detail image, which allows accurate diagnosis and treatment planning. However, there are some limitations. MRI are expensive to purchase and maintaining, but sometimes the scanning process can be quite slow. Even so, MRI is still the most important tools in modern medicine, which combine safety, precision, and advanced technology to improve patients' care.
The CT scan, which stands for computer tomography, uses X-rays and a computer to create clear 3D images of the body. CT scans are great for checking bones, lungs and emergency cases because they are fast and accurate, perfect for quick diagnosis. They give clear images and quick results, which really helps in trauma situations. However, there are some limits. CT scan involve a bit of radiation and aren't as detailed for soft tissues compared to MRI. Still, they are much faster, cheaper and quieter than MRI machines, making them a very practical choice for hospitals. Overall, CT scans are an important imaging tool because they provide fast, detailed results and help doctors diagnose and treat patients more efficiently.
Role of artificial intelligence in diagnosis. AI can help doctors analyzing medical data and images quickly and accurately. It can detect diseases early such as heart problem and cancer even before when the symptoms appear. AI also reduces human error and supports doctors in making decisions. It also doesn't replace the doctors, instead it acts as a smart assistant to improve the patient's care. In short, AI makes healthcare faster, safer, and more precise. Thank you.
Surgical and robotics, specifically robotic surgery. In robotic surgery, surgeons don't operate directly on the patient with their hands. Instead, they use a computer console to control robotic arms that perform the surgery, and this system allows for extremely precise movements that might be difficult with human hands alone. One of the main advantages of robotic surgery is that it is minimally invasive, meaning the cuts or incisions are much smaller compared to traditional surgery. Because of that, patients experience less pain, lose less blood, and recover much faster. Robotic surgery is commonly used in heart operations, brain surgeries, and orthopedic procedures where accuracy is especially important. A well-known example of this technology is the Da Vinci surgical system, which allows surgeons to perform complex surgeries with greater precision and control. Overall, robotic surgery represents the perfect combination between human and machine precision.
The transition from paper records to digital system has completely transformed the way healthcare manages information. In the past, patient data was kept in thick paper files which were often difficult to read and time-consuming to access. Today, with the electronic health record or EHR, all patient information is stored digitally in one centralized system. It allows authorized healthcare professionals to instantly view a patient's complete medical history, including allergies, medication, and test results. This shift has greatly improved accuracy, reduced medical errors, and made patient care faster and more efficient.
Today I will talk about big data and AI in healthcare. So once we move patient record from paper to digital, something amazing happened. That is, we create a big data. That means now we have a million of health records that computer can analyze. This is where AI become a game changer. AI took all of this data and find patterns that doctor might miss. For example, it help predict disease, figure out which treatment that work best for certain group of people, or even spot early warning signs of serious conditions like heart failure before patient feels sick. So today, data isn't just stored, it used to save life. This is a real power of digital healthcare.
Privacy and security challenges in medical technology. You know how everything is getting digital now? Well, the more data we collect, the bigger the security challenge becomes. Especially when it comes to medical data, which is like the most sensitive information. That's why there are really strict rules like HIPAA and GDPR. Both are to make sure that all patients' information stays protected and private. To do that, there are a few layers of security that we use. First, there's encryption, which means it scrambles data so that no random person can read through it. Then, there's access control, where it limits data access to authorized personnel only. Lastly, cybersecurity monitoring, which means constantly keeping an eye out for any threats or any weird activities online. At the end of the day, using data helps to improve healthcare. However, your privacy won't ever be compromised. To sum it up, security isn't just some technical add-on. It's a must-have, a core part of medical ICT.
So, what is the essential foundation of data management? It can provide access, guarantee accuracy, and power AI-driven insights. For going forwards, the focus is on interoperability that can make sure every system can talk to every other system seamlessly across different hospitals, even countries. This is what truly connects the fragmented healthcare world.
Telemedicine is an innovation approach that connects patients and healthcare providers through the telecommunication technology. It allows medical consultation, diagnosis, and follow-ups to be done remotely without the need for physical visit. This method is especially helpful for patients living in rural areas or those with mobility issues, as it saves both time and travel costs. Through telemedicine, doctors can monitor patient health, share medical information, and even provide treatment advice in real time. It also improves healthcare accessibility and ensures continuous care even during emergency or pandemics. In short, telemedicine strengthens the connection between patients and healthcare providers by making medical service more efficient, convenient, and also accessible to everyone.
Remote monitoring such as smartwatch can monitor the heartbeat and detect disease, collect data, and transmit real-time psychology data. It was also the practice of observing the managing system, devices, or people from a distance, typically using technology and an internet connection. Common application is include monitoring IT infrastructure for performance issues, checking patient health outside of a clinical setting, and overseeing devices to ensure security and proper functioning. So, what is the benefits of remote monitoring? It is included increased access to care such as RPM can extend healthcare services to patients in remote or underserved areas. Secondly, it reduces costs because monitoring system remotely can lower delivery costs compared to in-person visits or on-site maintenance.
Under connectivity and patient, we have virtual health. So, virtual health education use online platforms to teach patients about healthy lifestyles, disease preventions, and treatment options. So, it empowers patients to manage their health better through digital connectivity. It helps connect doctors and patients even if they are far apart, especially in rural areas where access to healthcare is limited. Through this, patients can learn at their own pace and get reliable information directly from professionals.
Our next point is about mobile health applications, also known as mHealth. These are the apps that people can install on their smartphones to help them manage their health. For example, some apps can remind patients when to take their medicine, track their blood pressure or heart rate, and even send progress updates to their doctors. This makes healthcare more connected because doctors can monitor their patients remotely without needing them to come to the clinic every single time. It also encourages patients to take more responsibility on their own health. In our short ad, you'll see a patient receiving a reminder to take their medicine from their doctor so that the doctor could track their progress. This shows how technology improves communication and helps patients to stay consistent with their treatment.
A clinical decision support system, or CDSS, is a computer-based tool that helps doctors and healthcare professionals make better clinical decisions. It gives alert, reminders, and evidence-based suggestions to improve patient care. Some advantages of CDSS include improving diagnosis accuracy, reducing medical errors, saving time, and increasing patient safety. It is also supports healthcare workers in making faster and more effective decisions, which leads to a better overall treatment outcome.
Technologies and artificial intelligence are transforming the way how medicines are discovered. They speed up the process by analyzing huge amount of data and also identifying which chemical compound is the best for effective drugs. This saves time and research costs, allowing scientists to focus on the most promising treatments instead of testing thousands of options manually. A great example is during the COVID-19 pandemic, when AI and digital tools helped researchers quickly identify antiviral drugs and vaccine components. Thanks to these technologies, medical research today is faster, smarter, and more efficient than ever.
And my point is how AI improves medical imaging and research. AI helps researchers analyze medical data quickly, find small patterns that doctors might miss for early diagnosis, and improves speed, accuracy, and decision-making in healthcare. For example, AI can detect early signs of cancer and predict effective treatment faster than traditional methods.
Computers are essential in modern medical research because they can handle enormous amounts of data quickly and accurately. They allow scientists to compare results, identify patterns, and discover new relationships between diseases and treatments. With powerful software and cloud systems, researchers from around the world can share their data instantly, making collaboration faster and more efficient. For example, computers helps researchers to analyze thousands of DNA samples to find genetic causes of rare diseases.
And I'll be talking about artificial intelligence in mental health research. AI is now helping in mental health research by analyzing things like speech, facial expression, and even social media posts to spot early signs of depression or anxiety. This helps researchers to understand emotional patterns and behavior changes over time, so problems can be identified earlier. The data also help to create better digital therapies. For example, the robot app uses AI to chat with users, track their emotion, and provide useful data for researchers to improve mental health and treatment. That's all from me. Thank you so much.
To explain appointment scheduling is where automated scheduling systems streamline the management of patient appointments. Patients can book, reschedule, or cancel appointments online, while the system sends automated reminders via SMS or email to minimize no-shows, which is when patients do not attend the appointment sessions. These tools also optimize doctor schedules, allocate clinic resources efficiently, and monitor patient flow to improve service delivery and reduce administrative workload for staff.
Now I will present about medical billing. This software performs several key administrative functions in healthcare. First, it handles processing insurance claims by automatically preparing and submitting claims to insurance company using standardized billing codes such as ICD and CPT, ensuring accuracy and compliance with healthcare standards. Next, it focuses on managing payment, where the system tracks payment from both patient and insurance providers, identify pending or denied claims, and allows staff to quickly resolve any issue. Finally, the software provides reporting and analytic capabilities that generate detailed financial reports, helping healthcare administrators monitor revenue, identify financial trends, and make informed budgeting decisions.
Automated inventory management systems track stock level, expiry dates, and usage patterns in real life. They can generate alerts for low stock items, automate reorder process, and integrate with procurement systems to ensure continuous availability of essential medical materials. This reduces waste, prevents shortage, and optimizes resources allocations, contributing to cost-effective healthcare operations.
Today I'll be talking about electronic health records management. It's a system that stores patients' medical data digitally. It allows doctors and staff to access records easily anytime and anywhere. It also improves accuracy and reduces the need for paperwork. EHR helps different hospital departments communicate better. And finally, it keeps patient information secure through data protection system. Overall, it makes healthcare faster, safer, and more efficient. That's all from me. Thank you.
To conclude, computers play a vital role in modern medicine, helping doctors and hospitals to improve accuracy, efficiency, and quality of healthcare. But as we move forward with this amazing technology, we must also remember the ethical side, protecting patients' privacy and using computers fairly and responsibly. So while computers continue to drive progress in medicine, it is up to us to make sure they are used with care and responsibility. From interpreting patients' data and managing medical records to discovering new medicines and streamlining hospital tasks, computers truly transform the way healthcare works. This is from SA1 and thanks for watching.